Alright, man, forgive the quality. It's not great. Alright, for cardiac, obviously you're going to want your patient's shirt to be off. Yeah, I'm not going to let you see our tits, so we're not going to do that. But we're going to start with the cardiac one, okay? So go ahead and lay back for me. And he'll already have the table set up for you and everything, so don't stress that at all. Let's do, okay, so first I'm going to start, I'm just going to inspect for jugular venous pulsations. And those seem to be normal. Okay, and now after that I'm going to go ahead and palpate the carotid pulsations for 3 to 5 seconds, just so you can feel that. It's just on the outside of the midline of the neck here. And then I'm going to come to the other side. Do the same thing. Now I'm going to auscultate those areas. So, tell your patient to take a deep breath in and hold it. And this is going to be done with the bell. For 3 to 5 seconds. Now tell your patient to go ahead and normally breathe, and then go ahead and hold your breath again. Okay. All right. So now we're going to move on. We're going to do the 5 points on the chest, and which so just the cardiac auscultation up here.
Let me sit up for that so you can see it real well.
So, yeah. So right here we're going to be doing this with the diaphragm. So come about right there, and actually go about right there with it. So that's spot 1.
So it's just right of the midline, and then left.
Alright, and those are the 5 spots. Now we will move on to the blood pressure phase. And first of all, you're going to start releasing the arm. You're going to first start with doing the target systolic rate. You can kind of BS this one. All you're going to be doing here is just get that radial pulse and just basically pump it up to where you can't feel it anymore, and then let go, whatever. He's not really going to check that. But then now we'll actually do the real blood pressure. And then record that using even numbers, okay?
That's kind of curious.
Okay. And then so go ahead and lay back. We'll do okay. Now we'll do the peripheral examination. So looking at your hands, do I see any discoloration, edema, any digital clubbing at all? I'm going to go ahead and check for capillary refill, and that's quick and normal. And make sure to do it on both hands. He counted me off for that. And do Tuger also too. And then we will palpate for bilateral radial pulse. We'll do that as well.
But don't do it with your thumbs.
So yeah, not with your thumbs. Okay. So there you go. And then we'll do the feet. So we'll check for digital clubbing. Can't see that real well. Digital clubbing. Digital pitting edema. Do that. In discoloration, do temperature, edema, capillary refill once again, and then make sure And then do toenails. Toenails look good, normal, absence of hair. Hope so. She's a woman, but that can be an abnormal sign. So whatever. So now the other two really important things, and make sure you do your dorsal patelis artery, and then your posterior tibial one, and that's behind the medial malleolus. That's going to wrap up that one.